A new advisory from the U.S. Surgeon General warns alcohol consumption increases the risk for at least 7 different types of cancer, including breast, colorectal, esophageal, voice box, liver, mouth, and throat cancer. And we're joined now by Surgeon Dr. Joanne Favuzza with Colon and Rectal Surgery Associates. It's part of St. Peter's Health Partners Medical Associates, and she's here to talk more about what every woman and really every family needs to know. Doctor, thank you so much for coming in.
Thank you for having me. This is such an important discussion to be having.
Absolutely.
Alcohol does increase the risk of all sorts of cancer. I'm a colorectal surgeon, and it's important in terms of decreasing your risk of colorectal cancer by limiting that alcohol use.
And alcohol can really have such an effect on our bodies. We know it's a risk factor. There's more and more research that shows there's no amount that's safe to drink. Tell us some of the different ways that alcohol can cause cancer.
Sure. Alcohol releases toxic substances such as acetaldehyde, and that can cause disruption of the DNA, which can cause cancer. It can cause increase in inflammation, and that can change, especially for colorectal surgery, your gut microbiome, and that can lead to cancer. There's also been some concerns about increases in estrogen that are related to the increased risk with breast cancer. Alcohol, interestingly enough, can also contribute to smoking, actually increasing that risk with both of those together.
I mean, when some people drink, then they smoke, and so now you're
and it will increase
multiplying your risk.
That's correct. That's correct. And so smoking, in addition to alcohol, increases it even more, your risk of cancer.
So what about the latest research now that's come out that talks about, let's focus on women who have 2 drinks a day and how that can affect them?
So I would say almost any amount of, we don't really know how much alcohol it takes to increase that risk. But especially for women, we are seeing in recent studies that women have an increased risk compared to men. And that's even less than 2 drinks a day. There is no recommended amount of alcohol that we can drink. We really don't know how much alcohol it takes to increase that risk of cancer.
Exactly. So since there's no amount that's safe, you really want to cut down. One of the things I remember reading about some of this research from the U.S. Surgeon General is women drinking, 2 drinks a day means that 5 more women out of 100 are likely to get cancer.
That's correct. And that's an alarming rate every year. And so I think that, as a colorectal surgeon, that is definitely something that I'm going to be asking patients more when I see patients in the office. And I think a lot of Americans don't realize that alcohol is a risk factor. I think we know obesity and smoking, asbestos, all of those things are risk factors that people are pretty well aware of. But alcohol maybe is not something that you think about, and it is a risk factor. And it is a preventable risk factor.
Right, and it's almost like people are turning a blind eye to this, even though we're hearing more of the research. So for your area of expertise, you're seeing more young people being diagnosed with colorectal cancer?
We are seeing more men and women being diagnosed under the age of 50. And that actually led to a lot of national guidelines changing recently so that the screening colonoscopy age is now 45 instead of 50. And that's because of the increased incidence of colorectal cancer that we have been seeing over the years.
In young people. And is it your personal opinion that drinking and people perhaps drinking at young ages could be part of this?
Absolutely. I think that it definitely is something that we should be thinking about. Maybe try and think about other ways that you can decrease your stress instead of alcohol, increasing your exercise, especially for colorectal cancer, preventing that, increasing your fruits and vegetables, high fiber diets, weight loss. All of those things can help to prevent colorectal cancer.
Stay away from the drinks whenever you can. That's really the best advice. Dr. Favuzza, thank you so much for coming and talking about this important topic. Really appreciate your time.
Thank you for having me.
Yes. You can find all of our Women's Health Wednesday segments online. Go to news10.com, look for Women's Health under the Community tab.